Hello. I'm really excited to share this research with you, as many have found it surprising, as it has really interesting implications, especially in highlighting the frequency with which we're finding that roaming dogs are owned. First and foremost, I want to acknowledge that this IFAW-supported research that I'll be discussing is the incredible work of Dr. Michelle Morters at Cambridge University. I'm sharing with her permission, but certainly want to begin by acknowledging that the research itself is her accomplishment. So I'm going to try to cover a lot of ground in 15, maybe 20 minutes. So just want to give you a general overview of where I'll be going. We'll provide a general sort of context for the research, talk about the research itself, we'll kind of speed through the methods, talk about a summary of the results, then the application at 2 IFAW projects, and then also consider some of the broader applications for dog population management and for us as practitioners. So considering the reason we've all come together, I know we've all spent a lot of time considering, seeing, thinking about dogs that are roaming in our communities or in another. And often the look of these roaming dogs can vary tremendously between communities. They might be on someone's property, they might be in a street or a field. You can find them roaming within a city, out in more rural areas. Sometimes they're healthy in appearance, sometimes they're not. And with the one unifying factor being that they're not under some direct control or they're not restricted by a physical barrier. So if you can actually take a moment and consider what are the first dogs that come to mind when you hear roaming dog or street dog. They might be in places where you live or places where you work, a place you've been. And so now that you have those dogs in mind, maybe even consider one dog in particular. And then I'm going to ask a question, and yesterday we heard really great and interesting points about how varied the definition of ownership can be. And so when I ask this question, feel free to think about it in broad terms in ways that are community and culturally appropriate. So with that dog in mind, the question being, is it owned? And how do we know? I mean, certainly if you've seen it with an owner, that's pretty clear. But oftentimes we don't. And we decide maybe based on how the animal's behaving or what we see them doing, scavenging or acting friendly or fearful of people. Maybe it's healthy or unwell. Of course, those of us working on dog population management have experiences and insights that are rich with information. And so many of us recognize that understanding the demography of domestic dog populations is essential. It's essential for effective disease control, particularly of canine-mediated rabies. In fact, really anything that's happening at the population level, and then how that ends up coming down and impacting the health and well-being of individual animals. However, prior to Dr. Morters' work, there's been no published study that has comprehensively evaluated the contribution of demographic processes in roaming dogs, such as births, deaths, and movement, to variations in population size or density, or determine the factors that regulate these processes, including human factors. So, in short, where are dogs coming from, where are they going, and what role do humans play in that? Which takes us to this research, which was a 3-year cohort study of domestic dogs focused on 2 communities in each Bali, Indonesia, and Johannesburg, South Africa. So these communities were chosen based on several criteria, including the fact that there had not previously been any dog population management interventions in these communities, not by animal welfare NGOs, not by local government authorities. And just to give you a bit of a picture about what these places are like, in Zenzele and Bram-Fischerville, households are a small dwelling, as you can see from the picture, usually made up of a variety of things. The household consists of any collection of family units. They tend to be unstable units and highly fragmented. And in Bali, a household is really ostensibly the equivalent of an entrance and consists of an extended family with a collection of homes or structures in which those family units live. And they tend to be quite stable and formatted based on cultural norms. So now I'm just going to kind of breeze through the methods. So you have a sense for how the research was conducted. However, if you're specifically interested in the methodology in depth or any other aspect of the research, I certainly urge you to read it directly, and there's some citations at the end of the presentation. So the research was conducted over the course of 3 years, from 2008 to 11. Households were visited door to door. There was a census every 3 to 4 months. And individual level data was collected for every dog. There was an owner questionnaire, there was direct observation, there was photograph taken. There was also focus groups with community leaders, members, and study enumerators, including participatory rural appraisal, and you can see the acronym up there, PRA, techniques, which were used to investigate the ecology of the dog population as well as to develop that questionnaire. So again, the study comprised of every owned dog, every single household in these study areas. Each dog was included immediately upon identification, and it was recognizable and monitored over the course of the entire study or until it left the study area. Pups were recorded but not fully assessed until they were 3 months of age. And other than rabies vaccination, there were no interventions occurring over the course of this study. In addition to owned dogs being monitored, every dog encountered in a yard, not their own, or on the street, was identified as either belonging to a household in the study area or not. And if it was not identified as being belonging to a household in the study area, then it was identified and classified as being unowned. So just to give you a sense for the general scope, here are the overall numbers. Total number of households, 5,600 in Johannesburg, 560 in Bali. And so now, sort of having breezed through the methods and given you some preliminary numbers, I'll get into some of the really striking results. So this graph, as well as the others to follow, show the overall population of community dogs over a 3-year period. The x-axis is time and the y-axis is population size. And you can see from the nearly horizontal line that the population remained constant over all 3 years. Similarly, the percentage of dog-owning households was approximately constant, 7.5% at the start, 7.8% at the end. And for dog-owning households, the number of dogs remained approximately 1.3 dogs per house. In Zenzele, we see there was actually a decline in the population. The percentage of dog-owning households was approximately constant, and as in Brom-Fisherville, there were approximately 1.3 dogs per dog-owning household. In Calusa, we find that population growth is similar in that there isn't any. The population remained constant overall in Calusa. The percentage of dog-owning households was also constant, and there were approximately 1.7 dogs per dog-owning household. And then finally in Antigua, as in Zenzele, we actually saw a decline in the population overall. The percentage of dog-owning households also declined, but there was a constant 1.3 dogs per dog-owning household. Worth noting also that there was a rabies outbreak in Bali over the course of this study, so the decline in population may actually be attributable to the fact that people were bringing fewer dogs into the community because of fear of rabies. So, in summary, 2 communities had a constant population the entire time. 2 communities actually saw a decline in their populations. The number of dogs per dog-owning household remained constant, and very interestingly, there were only 2 dogs in Johannesburg and 18 dogs in Bali that were identified as not being owned. So, to demonstrate what this looks like, here's 100 dogs, and this is what the percentage of unowned dogs in Antigua look like, 1.5%. A dog and a dog butt. Here is Calusa, where 1.1% of the dogs were unowned, and here's this one green dog that represents the number of unowned animals out of 100. And then lastly, what does 0.1% of dogs in Johannesburg look like? Like that. That's 2 dogs out of almost 1,900 dogs. So to share some more results, it was found that a significant number of dogs were acquired from outside of the community. At least a third of the population was actually sourced from outside. So to give you an example, in Zenzele, that was 40.8% of the dogs came from outside of the community. Here's some of the numbers from the other communities. So clearly there were many dogs that were being brought in from elsewhere and then going out. At least 20% of the dogs registered during the starting census were present 3 years later at the end of the study. So again, in Zenzele, 28.2% of the dogs in that original cohort were still there after 3 years. And that's what it looked like in the other communities. So again, clearly there was also quite a turnover of dogs just in this period, which really connects to the interesting fact that almost all owned dogs had been reportedly fed by their owner on the day of the interview or the previous day. And the rubbish in the area was actually analyzed. It consisted mostly of inedible organic matter, and none of the sites were within 5 kilometers of other food sources such as abattoirs or rubbish dumps. So what does this mean? This is the most detailed demographic data currently available for domestic dogs in low-income communities in Asia and in Africa. And as stated previously, almost every single dog was owned by households in the study area. Dog population size in the communities is regulated by human demand for dogs, not environmental resource constraints such as the availability of food. And in fact, low nutritional value of refuse and poor body condition of most dogs not owned also suggests that environmental resources were probably inadequate to meet the energy requirements of those dogs that weren't fed properly by their owners. There simply wasn't enough nutritional content in the rubbish or other nearby food sources for a dog to be healthy and well if it was not being fed by a person. And this certainly starts to challenge and raise questions around the idea that dogs can subsist over time off of refuse and scavenging. It also means that mass sterilization alone will have a limited effect on population numbers where population growth is not occurring, and a large proportion of the population originates from outside of the community. So what this means is that communities are choosing how many dogs they want to have, and they effectively maintain those numbers. Even though there was a significant turnover of dogs in the communities, the overall population stayed constant or was even in decline. And the censuses were being conducted every 3 to 4 months, which means if a dog was lost, the household would very quickly replace it. So this is not to discount how critically important sterilization can be for a variety of reasons. But it does point to the fact that sterilization alone will not change the number of dogs because the community controls the number of dogs. If people want more or less dogs, that is how the numbers will change. So the results very clearly point to the fact that it's people in communities who control what's happening with dog populations, and that the care and ownership of dogs can be sometimes much greater than we might think, 99%, even almost 100%. This tells us that people make decisions about their dogs, and the really wonderful opportunity in this is that we can clearly see that dog owners are the key to improving dog welfare. So how does this translate into projects? In Bali, working with the Bali Animal Welfare Association, we focus on efforts at the Banjar level, which is a subsection of a village. Utilizing PRA, PLA tools during community meetings. Just a brief note about what I mean by that. It stands for Participatory Learning and Action. It refers to a facilitated process with community members. It results in a structured sharing of a progression of local knowledge. It's good stuff. I urge you to look into it if you're interested. So these tools, we work with community members to help them better understand the needs of their dogs and then also how to provide for them. We recognize that while we could be there for a moment to provide a vaccination or to provide food, it's going to be the owner or the caretaker who's there every day. To truly reach the dog, we need to reach the owner so that they can then reach the dog. And then we see that this translates into owners and their communities actually requesting services. So I'll share some general qualitative results from a few Banjars where IFAW and the Bali Animal Welfare Association have been working. As you can see, specific measurements reflecting dog health and well-being are reflected in that outer row, that orange row. And through community assessments, we looked at how those factors changed over time on a 5-point scale. And the improvement is indicated of that growth of the blue line around the green line. Again, in this community, we see similar improvements. Also important to note, again, that these efforts were focused on reaching people. So we were reaching owners to reach the dogs, and can see that it did in fact result in improvements to the health and well-being of those animals. So in addition to these assessments, there's a visible shift in the health and well-being of dogs in the communities. They look better, people are interacting with them more, handling them more frequently, and in fact, in one Banjar, they have said that they actually stopped selling their unwanted dogs to dog meat traders. So then in Johannesburg, with CLAW, Community-Led Animal Welfare, CLAW takes mobile clinics out into communities, neighborhoods are monitored, visited frequently. There's really powerful relationships built with these neighborhoods. Mobile clinics, as well as service provision in a primary clinic, focuses very heavily on interactions with community members. People have very deep bonds with their animals, and there's a lot of focus on supporting and strengthening that bond and the owner's ability to care for their dog. Taking the time to speak with and listen to individuals and provide specifically targeted care based on the health and well-being of the animals is an essential part. Also, taking the time to discuss the care with the owner and actually help the owner access what they need to properly provide for the animal is the critical piece that takes it from just changing things for a moment to changing things in the long term for that individual owner and dog. So then that takes us back to the question at the beginning, and that dog or dogs that we were thinking of, and that question of, is the dog owned? And how do we know? Because we can now recognize that if a dog is, just because a dog is roaming, if it looks a certain way, is behaving a certain way, unless we have identified it directly with an owner, these other things won't necessarily tell us that. So the critical question seems to be, have we asked the community? Have we spoken with dog owners? And what are they saying? What are they telling us? As practitioners committed to managing populations humanely and improving the health and well-being of individual dogs, we have the potential to tremendously improve our efforts by taking the time to truly understand the people as well as the animals that we're aiming to help. People make decisions about their dogs, and improving the health and well-being of dog populations must involve those who hold the key, community members and dog owners, every step of the way. We also have to be willing to challenge some of our assumptions and learn from what we see and hear when we're listening to people, when we're hearing new things, and listening to those who are caring for dogs. If we know that a key to improving the lives of animals is through the people who live with them every day, we have an opportunity to make great strides with our work. So thank you again to Dr. Michelle Morters for letting me share her research, as well as to the truly amazing people at CLAW and BAWA who are helping people and animals in their communities every day. Thank you.
We've got time for a couple of questions.
I think this really is an enormously important study, and I congratulate Michelle on what she's done. And I entirely agree that the dog population is managed or controlled by human desire. But I disagree with the claim that sterilization will not have an impact on dog population. There's a difference between humans accepting dogs in the community and wanting dogs in the community. And so in a place like Jodhpur, where they sterilized all the street dogs, the population dropped from 5 per 100 people to 3 and now 2 per 100 people. Mm-hmm. So the population has gone down because of the sterilization, because I think, once again, it's that acceptance versus desire that these are two different numerical values, and people may want some dogs, but not 5 dogs per 100.
Yeah, I mean, and the point about sterilization was specifically as it related to overall numbers of dogs, and I think it's also important in that consideration to think about what else might come along with sterilization. A lot of sterilization programs aren't just pick up a dog, sterilize it, and put it back. And there are questions about if you're doing that outside of doing anything else, you're just trying to control the numbers. There's nothing that's actually changing in anything that the community itself is doing, that we wouldn't necessarily see a change in those numbers, because people are somehow enabling those dogs to be there. And so unless that is changed, then just sterilizing animals wouldn't necessarily make a difference to the numbers overall.
Well, my comment is that India is different. There are lots of unknown dogs in India, in the sense of dogs that don't have a home,
Yeah.
of a place where they can be controlled. The reason why I think that is, for one reason, is that there's a very strong, marked and consistent seasonality in breeding, as is evidenced by percentage of pregnant females brought into clinics for sterilisation.
Mm-hmm.
So if these dogs are owned, then the owners are having no effect at all on the timing of breeding. Also, when you say that the observed behaviour of the dog tells you nothing, I would say that most of the dogs that I disturb during survey work run down the street. They don't go into a house. They show no evidence of having a safe place. They just move down the street and continue to move down the street if you continue to disturb them. I also point out that there's a lot of litters on the streets not the streets, but on the public areas in Indian cities. I'm not saying those litters survive. Maybe they don't. Maybe almost none of them make it to maturity. But there are many pups born outside of houses. So those are the comments. The question is, are you promoting sterilisation of dogs via the owners? And if you're not, what is limiting what you've observed as a limit to the population? The population isn't growing. If these dogs are roaming and they're unsterilised, what's keeping the population level?
So I'm not saying that sterilization is an unnecessary thing. In fact, it is a really critical piece of a lot of dog population management programs, and I wouldn't discount it. Not only is it important when people are engaged and they want fewer animals to help them get to a place where they have fewer animals, but we also know that it's important for a variety of other reasons. If there's concerns about sex-driven behaviors in the community that are a nuisance or really unpleasant, that it's really important for that. We also know that people deal with unwanted pups, for example, in a variety of ways that might be inhumane, and sterilization is really essential for that. So definitely not discounting it as an important tool. And what I've heard even over the past 2 days is how we are getting more comprehensive and integrating many components into these programs. And when it is done effectively and strategically with other components, I think it can be incredibly helpful. But the question is, if we're looking at using it alone, just all by itself to control numbers, that certainly in these places, it wouldn't necessarily make a difference.
Thanks. Last question, please.
Thanks. That's a great study by Michelle, and I think it's interesting to note the comparisons to my study site, and we're finding the same thing. I think these own populations, as we have in these two situations, are amenable to very different approaches in terms of studying them. And it would be great to see. I think those graphs that you show of this constant population can be a little bit misleading, because there's certainly no net population growth, but there's no doubt that there's very high population turnover, and it would be nice to sort of quantify that, given that we have the ability to do that using sort of standardized approaches. So my comment would be, it would be great to see that the birth rates, death rates, and migration rates given in terms of events per dog years in the population, so that we can start to standardize these rates and understand what's going on in these populations.
I agree. And I'll also say that Michelle has actually published 4 papers so far on her work that she's done there. I think that there's even some more forthcoming, and she's looking at the data that she has in a variety of ways. So I think there's a lot of different interesting things to look at, a lot of information she has. So I was only speaking to a part of it today, and I agree with you that all of that is really interesting, incredibly important also from a welfare perspective to see what's actually happening with those individual animals.
Can I just make a final point? I just think it's so interesting that what this research does, and particularly with Michelle's focus on pointing out that sterilization isn't going to reduce the numbers of animals in these communities, is really to point out that we can't make assumptions about the demography of any particular population. This study doesn't prove that there are no populations in the world in which there are unowned dogs which are freely reproducing. Certainly, I don't think any of us in this room think that would be the case. But what she's pointing out is that it does apply to these populations. And so we can't make assumptions about any of the communities in which we're working. We need to really look at the dogs, we need to look at the owners and understand the interactions between them, think about where the population is coming from, and as Darren points out, what the turnover is, particularly for disease management purposes.
Thanks. And so thank you, Hanna, and especially for presenting someone else's research. That's very difficult to do. So thank you. Sure.